What are all of the causes of acute pancreatitis? Acute pancreatitis is a must-know topic in surgery. It has such a high morbidity and mortality, and it's common, something we're seeing at least every week in a tertiary referral center ER. Today, I'm going to take you through the causes of acute pancreatitis and how you can remember them. We're going to go through some easy to remember acronyms. You'll never forget it after this. Let's go. Welcome back to Citizen Surgeon. My name's Dr. Erik Pearson. I'm here to get you comfortable on the ward, in the ICU, in the operating room, and of course, on the exams. Today is Acute Pancreatitis Day. Well, specifically, we're going to be talking about the causes of acute pancreatitis. Now, you have probably gone through your Surgical Secrets book or the textbook of your choice, or maybe one of those notebooks, and you found that there are a ton of different acronyms to learn the causes of acute pancreatitis. The first question, though, always is why? Why do we have to understand acute pancreatitis and its causes? Well, it's common. And when we look at the incidence and prevalence of acute pancreatitis, we can see that this is a common problem. So we got to know it. So the incidence, or the number of new cases per year per an amount of population, is about 5 to 35 per 100,000. Okay. Well, the prevalence is the amount of a disease at any given point in time. All right. So let's take Las Vegas. Okay, we got the welcome to Las Vegas sign. How common or how much acute pancreatitis do we see on average in Las Vegas? Well, Las Vegas is a city of approximately 3 million people, about 2.8 million, but let's round up to 3 million people. So if we look at the incidence, we can see that there's about 100 to 1,000 people per year that are going to be diagnosed with acute pancreatitis. And at any given time, we may have between 300 and 3,000 people with acute pancreatitis. So this is a common problem we're seeing in our emergency rooms. As surgeons, we're going to be consulted with this. We're going to have to know what to do, and we're going to have to elucidate and think about those causes. So if a patient comes in with the signs and symptoms of acute pancreatitis, what could have caused it? Now, the other thing that's important to consider is the mortality rate. So we know that morbidity is high, and when we go through the clinical aspects of acute pancreatitis, we talk about pseudocysts, we talk about necrotic pancreas or necrotic pancreatic collections or pancreatic abscesses and the need for pancreatic necrosectomies and all of that stuff. We're going to cover that all. But to know the mortality rate is 2 to 20%. So that's up to 1 in 5 people dying from severe acute pancreatitis. So it's common and it's lethal. So we gotta understand it as surgeons taking care of this problem. Now I'm gonna divide this into really 4 parts, okay? So part number 1 is gonna be the causes, and that's today, okay? Then we're gonna get into the pathophysiology of acute pancreatitis. We're gonna get into the workup of acute pancreatitis. Then finally, we'll get into the treatment of acute pancreatitis. So we're going to take 4 videos to go over this really important topic. I'm going to make it super helpful, super dense, high value for you. And now, causes. So acronyms. What acronyms have you heard or learned to remember all of the different causes of acute pancreatitis? Now, whatever acronym you choose, it doesn't include all of the causes. And if you stick around to the end, I'm going to go through my favorite acronym, okay? And then I'm going to show you what it's missing, all right? So stick around for that, okay? So what are some sample acronyms? Well, the one that we're going to go over today, that's Get Smashed. And I do have a little variance of this that we're going to go through at the very end, okay? So stick around for that. Second is Apache, and then third would be Midge. Pancreas is another one. So there are a lot of different ways to remember all of these causes, but let's get right into it, and we're going to use Get Smashed to remember those. And why do I like Get Smashed? Well, I like Get Smashed. It's kind of funny, but mostly because the first 2 account for 80, maybe almost 90% of all causes of pancreatitis. So they're right up in front, okay? So what is that first one? What do you see right here? What do you think? Okay, well, the first one is gallstones. Now, if you haven't checked out the gallstones video, I want to hark back to that one. That is an awesome video. We go through why the body makes gallstones, how that solubility triangle works out if you have too much cholesterol or not enough phosphatidylcholine or not enough bile salts. Okay, so check that video out and you're going to know and you're going to understand well why we get cholesterol stones or why we get other types of stones. So check that out. But that is the #1 cause of acute pancreatitis in the United States is gallstones. So why do gallstones cause acute pancreatitis? Now for each of these causes, I'm going to go through the why. So that is really important. You never want to just remember something. You got to know the why. So why do gallstones cause acute pancreatitis? If we remember back to the gallbladder anatomy video, I went through the anatomy of the biliary tree, I went through the gallbladder anatomy. And if we think that if a gallstone gets stuck in that ampulla vater, we're going to get backup of bile into the pancreatic duct. What's that going to do? That is going to cause the release of pancreatic enzymes. So what are some of those pancreatic enzymes? Well, we have amylase, okay? Amylase breaks up different sugars. We have peptidase, and peptidase breaks up proteins. We have lipase that breaks up fat. We have phospholipases. We have nucleases. There's trypsin, there's trypsinogen. All of these things are activated when a gallstone blocks that pancreatic duct and causes backup of that pancreatic juice within the main and even the accessory pancreatic duct. Okay, so when that happens, those enzymes are liberated, they cause inflammation of that pancreas, and that becomes a vicious cycle. We're going to talk about that a little bit later. So let's say that somebody has gallstones. What are the things that are going to increase the risk of a patient with gallstones getting pancreatitis from those gallstones? All right, well, one is if they have large cholesterol stones. All right, two is if they have a narrow common bile duct. So a stone is more likely to become obstructed in a narrow duct. And three is if they have a history of chronic alcohol abuse or hypertriglyceridemia and they already have an injured pancreas. So these are some reasons why a patient with gallstones may be at a higher risk of gallstone pancreatitis. Okay, so that's G. That's about 80 to 85% of all causes of acute pancreatitis are related to gallstones. So let's move on to E. So we see this picture right here. What do we think E is? Well, E is ethanol or alcohol. And alcohol is the second most common cause of acute pancreatitis. Alcohol is actually the most common cause of chronic pancreatitis, but we're not talking about chronic pancreatitis today. We're talking about acute pancreatitis, okay? So the second most common cause is ethanol or alcohol, okay? Now, what does ethanol or alcohol do to cause pancreatitis? Well, first is alcohol causes the release of pancreatic enzymes. Now, you're going to see a common theme here as we go through all of these causes. There is a release of pancreatic enzymes. We already talked about what those enzymes are, okay? Second is that alcohol causes local ischemia within the pancreatic gland. It causes focal vasoconstriction and ischemia or poor blood flow into the pancreas, and that leads to inflammation. Third is alcohol leads to free radical production. That's pro-inflammatory within the pancreatic gland. And finally, immune activation. You know, in that first video I did, the metabolic response to injury, we talked about immune activation. So that would be your interleukin-6, your TNF alpha, these pro-inflammatory cytokines, which are going to start to accelerate this vicious cycle of inflammation within the pancreas. So why does alcohol cause pancreatitis? It releases digestive enzymes, it causes vasoconstriction and ischemia, it causes free radical production, and also it is pro-inflammatory. And if we go back to our diagram here of our acronym, get smashed, we have gallstones and ethanol. So T, what is T? Well, T stands for trauma, okay? Now, trauma can be direct blunt injury to the pancreas. It could be a stab wound or a penetrating injury to the pancreas. perhaps disruption of the main or accessory pancreatic duct, or it could be inflammation or injury to the pancreas caused during surgery. Perhaps you're doing a duodenal resection or cauterizing the duodenum and you injure the pancreas. Perhaps you're doing a right hemicolectomy and you injure the duodenum and the pancreas. Well, that can cause trauma and associated pancreatitis. Now, whether it's gallstones or alcohol or trauma, we see that injury of the pancreas leads to release of pancreatic enzymes. That's going to cause damage and injury of the pancreas. We're going to get a pro-inflammatory state. That's going to release more enzymes, more inflammation, and this cycle just continues, okay? So whether it's trauma or any of these, you get this initial injury, and that's going to cause the release of enzymes, and then this pro-inflammatory state is going to cause a vicious cycle, which is going to increase the severity of that pancreatitis, especially in patients who have increased risk already. Perhaps they're chronic alcoholics, or perhaps they have hypercalcemia, which we're going to talk about in a minute, or hypertriglyceridemia, and that's going to cause, or they have a genetic problem. We're going to talk about some genetic mutations that can predispose you to having a higher risk of acute pancreatitis. So if we look at our acronym, we have GET, SMASH, so gallstones, ethanol, trauma, S. What is the first S? Well, the first S is steroids, okay? Now, how do steroids cause acute pancreatitis? Now, I think the pathophysiology of steroid-induced acute pancreatitis is fairly interesting. So steroids increase the viscosity or the thickness of pancreatic exocrine output or pancreatic fluid, and that thickness causes blockage of the pancreatic ducts. And whenever we get blockage of those pancreatic ducts, whether it's a gallstone or steroids, we're going to get release of those digestive enzymes, and that's going to lead to this inflammatory cycle that we've talked about, okay? What else does it do? It causes ischemia or poor blood flow within the pancreas. And then, of course, there's an imbalance in the production of pancreatic enzymes. So all those things come together is the pathophysiology of why steroids cause acute pancreatitis. Okay, back to the acronym. Gallstones, ethanol, trauma, steroids, M. What is M? Okay, so M is the mumps. Okay, so mumps got inflammation of our salivary gland. It's an acute infection of the respiratory epithelial cells. And what happens? Well, the infection of this virus into the respiratory epithelial cells, that is spread to the pancreas. Pancreatic cells get infected by the virus, and that causes blockage. It causes a pro-inflammatory state and release of digestive enzymes, more cytokines, pancreatic injury, and acute pancreatitis. Now, in addition to the acute pancreatitis caused by the virus specifically, the immune response, so we're going to get antibodies, we're going to get B cells producing those antibodies, we're going to get CD4 cells, CD8, cytotoxic CD8 T cells. Those are also going to attack the pancreas. In addition, these pro-inflammatory cytokines, and we're going to get more pancreatic injury, okay? So you can see every single one of these causes, like I've said, it's a similar pattern. Either we're getting blockage or we're getting an attack on a pancreatic cell, which is releasing those digestive enzymes and causing pancreatic injury. Okay, going back to the acronym, we got GET SMASH. So gallstones, ethanol, trauma, we have steroids, we have mumps. Now to A. What is A? What could it possibly be? All right, so I have this picture right here. Is this a clue? Do you get it yet? All right, this is autoimmune disease. So autoimmunity, what's the pathophysiology? It's usually kicked off by a viral infection, okay? That viral infection stimulates antibodies to be produced. Those antibodies, perhaps there's some mimicry, but they attack pancreatic cells, release digestive enzymes, and you also get those CD4 T cells, CD8 cytotoxic T cells, also complementing that inflammatory response and causing pancreatic injury. So, autoimmunity, usually triggered by a viral infection, is another cause of acute pancreatitis. Okay, now, reviewing again, GET SMASH. So, gallstones, ethanol, trauma, steroids, mumps, autoimmune, another S. What could this be? Okay, we get a lot of these in Las Vegas. In fact, My daughter was stung by one of these, ended up needing to go to the ER, got the antiscorp, antivenom, and it worked amazing for her because she was very, very sick getting a scorpion bite. Okay, I hate these scorpions. They're always around palm trees, new construction. If you're in a neighborhood that there's a lot of new construction, you got to watch out, watch your shoes, because they could have scorpions in them. Okay, we don't have bugs here, but we have scorpions. Anyway, back to get smashed. So scorpions, what type of scorpion is it that causes acute pancreatitis? Well, the most common one is Lyris quenquestriatus. Now, forgive me, I probably didn't say that correctly, but these scorpions are the yellow scorpion. They're found in North Africa, and there are other scorpion species that cause acute pancreatitis, and that's listed here, okay? But and these are found all over the world, different parts from North Africa to Brazil. But the important part is the venom that specifically attacks the pancreas. Now, I tried to look it up and see what that mechanism of action is, and so I have a little bit of data for you here. But importantly, the venom attacks pancreatic cells. It causes them to swell, burst, release digestive enzymes that starts that inflammatory cascade. The venom also acts on very specific receptors. You can see those here, and those receptors, once activated, also kick off a pro-inflammatory cascade. Then the third thing is some of this venom contains hyaluronidase. Now, hyaluronidase breaks down hyaluronic acid, okay? And what is that? That's a substance that holds cells together like an extracellular matrix. And so hyaluronidase is in the venom, and that's broken down too, okay? So these are the reasons why scorpion bites can lead specifically to acute pancreatitis, and I had those various scorpion species listed just above, so you can review that if you want to have some good trivia for the OR. All right, so now we have gallstones, ethanol, trauma, we got steroids, mumps, autoimmune, scorpion bites, and H. Well, H is a bonus letter because you get two, okay? H is both hypercalcemia and hypertriglyceridemia, all right? So I have that both here. We can see some fat lining this blood vessel, and of course, a nice healthy bone full of calcium, all right? So how do they lead to pancreatic injury? Well, hypertriglyceridemia, that is pretty straightforward because too many triglycerides are going to lead to thickening and blocking those pancreatic ducts. And again, when those pancreatic ducts are blocked, whether it's a stone or whether it is a steroid causing that pancreatic fluid to be thick, or in this case, too many triglycerides, you're going to have backup of those digestive enzymes. Those are going to be releasing and injuring the pancreas. All right. So hypercalcemia, what does that do? So increased calcium, that causes pancreatic cells to release more digestive enzymes. It's a stimulant. Second is hypercalcemia causes focal vasoconstriction within the pancreas that leads to ischemia. Third is hypercalcemia leads to oxidative stress. Okay, that may be also in the form of free radicals. And hypercalcemia, it promotes inflammation. So it is pro-inflammatory. So that is one of the reasons why hypercalcemia leads to acute pancreatitis. And we go through all of these, and if you understand the why, then you are going to remember them all. You may even need an acronym, okay? So get smashed, all right? I've done this a bunch, but by the end, you're going to totally remember it, okay? Gallstones, ethanol, trauma. We got steroids, we got mumps, we got autoimmune, scorpion bites, hypercalcemia, hypertriglyceridemia, and now to E. What is E? Well, E is ERCP, okay? One acronym stands for another acronym, but what is ERCP? So endoscopic retrograde cholangiopancreatography, and that leads to acute pancreatitis in 2 to 10%. So if you got to get an ERCP to remove a stone from the duct or to stent open the duct because perhaps you have a cystic duct leak, then the incidence of pancreatitis in that case is 2 to 10%. All right, well, why does it happen? It happens possibly because the pancreas has been injured, okay? Second would be that the pancreatic duct is blocked by sludge or stone, and that causes backup of bile into the pancreas, backup of pancreatic fluid to cause that release of enzymes, injury to the pancreas, okay? Or there could be bacterial translocation. So if the bile is infected and we infect the tissue, the fluid within the pancreatic duct, can infect the pancreas and lead to pancreatitis, infection and inflammation, okay? Or drugs associated with the scope itself. It could be from the sodium bicarbonate used to flush the duct. It could be from the chemicals used to clean the scope. Okay, so not entirely understood why, but these are all the reasons that ERCP may lead to acute pancreatitis. Okay, so again, get smashed. Gallstones, ethanol, trauma, steroids, mumps, autoimmune, scorpion bites, hypercalcemia, hypertriglyceridemia. E is for ERCP, and D is for drugs. All right, so there are a number of different drugs that can lead to acute pancreatitis. The ones that come up in the exam seem to be azathioprine, 6-mercaptopurine, cyclosporine, those immunosuppressants. But there are other drugs that can cause acute pancreatitis as well. So this is a list of some of the drugs that cause acute pancreatitis. So check that out. And each of these is going to have their own specific mechanism of action. So one final time, get smashed. Gallstones, ethanol, trauma, steroids, mumps, autoimmune, scorpion bites. What are those? What scorpions were they again? All right, if you can pronounce it. All right, hypercalcemia, hypertriglyceridemia, ERCP, and drugs. Now, if you want, and you can't figure it out, and you don't know the cause of the acute pancreatitis, there's another acronym. You could put an I in front of this. So I get smashed. Okay, and what does that I stand for? That stands for idiopathic. That means you couldn't quite figure it out. Now, there are some other causes on here, and there are probably ones I'm not going to even mention today that didn't make it in the I get smashed acronym, okay? And so what is one of those? So one is genetics, okay? So PRSS1 mutations or CFTR mutations, for example, in cystic fibrosis, can lead to an increased risk of pancreatitis or increased predisposition to pancreatitis, okay? Second would be cancer. So an intraductal papillary mucinous neoplasm or IPMN, okay? Or perhaps a pancreatic adenocarcinoma may lead to acute pancreatitis or be the presentation of that underlying cancer. And then perhaps pancreatic anatomy. So if you had a pancreatic divisum present, that could lead to acute pancreatitis. All right, today we went through the causes of acute pancreatitis. All right, we went through the longest acronym that I think makes the most sense because G and E, the two most common causes, are right in front, and that's gallstones and ethanol, okay? We learned the rest of them, and that should stick because I said it about 50 times today, okay? So I'll put a link to the references in the description below. As always, I really appreciate it when you engage and ask me questions. I love it. It makes me feel like I'm giving you guys value and that you are learning, and that's what keeps me inspired to make more videos. All right, so give this video a like if you liked it, share it with your friends if you think that you can spread some goodness, and of course, subscribe to the channel, and I will keep making these. All right, so study hard, stay safe, remember, get smashed, and I will see you next time.